Vaginal atrophy is a symptom of menopause. We call it genitourinary syndrome of menopause. It is an indication, according to the FDA, to take hormones, and that includes systemic hormones. However, there are several options for vaginal preparations. The thought is if you take a hormone vaginally, it is not going to give you the same risk as it would systemically if you are using a patch or swallowing a pill. And most of these therapies are safe for patients with a history of breast cancer, but you should also always check with your doctor. So the most commonly thing prescribed would be a form of estrogen. Now remember, just with the vaginal preparations, there are synthetic like Premarin, which is conjugated equine estrogen cream, and then there's bioidentical, which would be estrase. Estrase comes in the form of a cream, it comes in the form of a vaginal ring, which is estradiol, and a little tablet called Vagifem or Uvifem. So I like the tablet, it's not as messy. The creams can be good because you can fill up the applicator and put it in the vagina and use some and put it on externally on your vulvar area if you're having a lot of symptoms there as well. However, there's another FDA-approved medication called Introbrosa, that is vaginal DHA. And in my experience as a gynecologist, when I used to do vaginal exams and I could see the before and after on the vaginal tissue, on the vulvar tissue, and talk to the patients about their symptoms, I feel like DHEA or Introbrosa or progesterone is far superior for severe vaginal atrophy, especially if it's in the lower third of the vagina and the external genitalia, with urinary symptoms, with decrease in sensation. Vaginal DHA has been studied and FDA approved and found to help all 4 phases of the sexual response cycle. That's sensation, that's desire, climax, and also vaginal pain. So I think those are an option. Right now that's formulated in a suppository that you would use. We usually tell patients to use them every day for 14 days and then once or twice a week thereafter. You can also get something compounded with estriol that's not FDA approved, and also testosterone. Again, not FDA approved, that would be from a compounding pharmacy. Once patients do the 2-week induction, they may not need it twice a week. Some may still need it 3 times a week, some may do it twice a month, and that's the beauty of it, is that you can just use it as you need it. What we are telling patients is you don't need to worry about stimulation of the uterus, you don't need to worry about progesterone, and certainly if you have a uterus, and you do not need to worry about stimulation of the breast. I have had some people though, when they've taken the vaginal Premarin, have systemic symptoms of breast tenderness. So not everybody is the same. Doses do vary. Some of it's high dose, but it's generally thought is safe.
Hi, Dr. Saxena here, Chief Medical Officer at Form Health. Thanks for visiting our channel. Make sure to subscribe to get the latest insights and information on functional and integrative medicine.